there's Councillor Huffman.
I'm working on Councillor Taylor right now, getting him the link.
And Jill Doherty, is she in attendance?
She will be in attendance on the closed meeting link.
Come again?
No, it should be for the open meeting link, Kevin, not, it'd be the exact opposite. She shouldn't be on the closed.
Oh, shoot. Okay, I'll let her in then.
So Taylor.
All right, I've sent Jill the correct link.
I see Jason Godby's on. I don't know that he needs to.
I just got you guys in the background because this is the same link for public hearing, right?
That's correct, yes.
Okay.
Yeah, so the public hearing won't start till 3.
Won't start till 3. Same for you, Mohammed. The public hearings won't start till 3 o'clock.
Is it? Okay. I will just go away for an hour.
Find us some water.
All I gotta do is drive to the lake.
Okay, Fabian's going. Okay. So we're just waiting for Jill. Okay, Ryan. Ryan says he's, oh, there he is. Have you heard from Jill, Kevin?
No, I haven't heard back from her, but the link has been sent. So she might be on the wrong one, but I told her it would be 2:30 for the closed session. Apologies on that. I wasn't aware that she was supposed to be in the open.
All right, so I guess we'll just get going here. Jason can reach out to Jill. We'll get through the approval of the agenda and so forth, so that we're ready to go. So first of all, we'll begin today with the Board of Health meeting, and then we'll need to begin by 3:15 at the latest for the public hearings. So it may require an adjournment of the Board of Health. I had anticipated that the Agricultural Advisory Board would be making a presentation today. However, the Board of Health was informed yesterday that our medical officer of health was ill and would not be in attendance for this afternoon's meeting, and that he has sent his lawyer, Jill Doherty, who will be joining us shortly, as his representative. I just sent to council a few moments ago. As a result, I asked our chair of the Agricultural Advisory Board, as opposed to making the deputation today, since Shanker wasn't here to answer questions, if they could condense some of their concerns, certainly concerns that the board is aware of, into written format. So I distributed those to each of the councillors. Kevin, my apologies, it just happened a little while ago. I will send all of those to you, and if you could please include those for public record. So we'll add that as a change to the agenda to go through those communications here today as well. So first of all, I guess, so again, the only change to the agenda then would be to add these 4 items of communication, and we'll go through each of those. Other than that, are there any other changes to the agenda? All right, seeing none, if I could have a mover and a seconder. Councillor Columbus, seconded by Councillor Taylor. All those in favor? And that's carried. Are there any declarations of pecuniary interest? All right, seeing none, I guess we'll just go through those items of communication that will be added. And I think what's likely appropriate, again, council's had a chance to review, is that we asked questions of Ms. Doherty as the presentations go through, since they're relevant to the update on the migrant farm worker travel directive. But we'll move to add each of those items of communication. If you just give me 1 second here. So the first item of communication is from Ryder Farms. If I could have a mover and a seconder to accept that item of communication. Councillor Michelli, seconded by Councillor Huffman. All those in favor? That is carried. I guess I should have done them all together here at once, and we'll do the next 3 together. The next one is from Strawberry Time Farms, Diane and John Cooper, followed by followed by the letter from the Agricultural Advisory Board itself, and then a letter from Easy Grow Farms and Dusty Zamanek. If I could have a mover and a seconder to receive those 3, Councillor Columbus and seconded by Councillor Taylor. All those in favor? And that's carried. All right, Jill, I see you're online with us. Thanks for joining us. So everyone, Jill, I guess as the chair of the Board of Health, I just want to understand your position today. My understanding was that you had been hired in response to the appeal for the 3-man to a bunkhouse rule. So as chair of the board, I was unaware that you were even engaged by Dr. Nessathari. So is that on what matters have you been engaged in, just so that the board understands? Because as of right now, I haven't seen any challenges.
So I've not been engaged by Dr. Nessathari personally. The basis on which I was engaged was simply that Ms. Budis is, as I understand it, occupied on an LPAP matter that is going to, I think keep her tied up for a number of weeks. And she asked if I could provide assistance to the public health unit, and also attend the Board of Health meeting. So I am simply here to assist in whatever way I can, and then to provide advice to the health unit just during Ms. Budis's absence. So that was the basis on which I was retained.
Okay, so just so I'm clear, when you speak of the health unit, you are providing advice to the health unit and not to the Board of Health, or are we, as the Board of Health, also able to ask you for advice?
Well, you're certainly welcome to ask me legal questions relating to the instruction. It was also my understanding that the Board of Health may have retained independent counsel. I frankly don't know the detail of that, and the basis on which I was approached was simply that there was going to be a chunk of time where Ms. Budis would be tied up on an LPAT matter and not available to provide assistance to the health unit, and that in case they needed someone to field legal questions on a time-sensitive basis, that I'm available to, provide that advice during Ms. Budis's absence. And I was asked to attend today at this Board of Health meeting. So that was sort of the very limited basis of my retainer. And as I say, I was told that the Board of Health might also have their own legal counsel. And so, as I say, that's sort of the kind of full universe of my knowledge of what the legal arrangements are.
Sure. Okay, thank you. I just always happy to see you. If I was to choose a lawyer, you certainly would be top of my list. I'm just,
that's very
you can
kind
appreciate
of
as the
you.
chair of the board, this is all kind of coming at us out of nowhere. We don't have any legal representation here today, and I think that it is becoming very challenging of understanding what lawyer is representing what interests at this point in time. So I just wanted to provide some clarity for the board, but also myself, because I'm kind of sitting here a bit confused as well as to how this all came to be. So moving on, I guess, Heidi, are you going to be presenting both of the presentations on behalf?
Yes, Mayor Chop, I will be.
All right, if you would like to go ahead. I think the first one is just the general update, followed by the update on the migrant worker directive. We're likely to have a number of questions on the second item, which I understand you may or may not be able to answer, but at least we'll get those on the record, and perhaps Ms. Doherty might also be able to comment.
Thank you, Board Chair Chop. Good afternoon, everyone. Through you to members, I will give a brief verbal update on the COVID response, and then we can go directly to the PowerPoint presentation on the temporary farm worker transportation directive. So in terms of our COVID-19 response, the health unit has three key priorities. Case management and contact tracing being one, including outbreak management, ensuring the safe arrival of our temporary farm workers, and is supporting through the self-isolation period. And then, of course, the vaccination rollout being the third, in no particular order of importance. So in terms of our case count, today we have 118 active cases. That includes 2 workplace outbreaks, 2 cases in 7 different schools, 2 school outbreaks. And when we're talking about an outbreak in a workplace or in a school, that is where there are at least 2 cases where the transmission is linked back to either that workplace or that school. So that is the definition of what leads to an outbreak.
Sorry, Heidi, I'm just going to interrupt. Kevin, was there not? I thought there was a PowerPoint to go along with this. Was there not?
There's a PowerPoint to go along with the update on the migrant
Oh,
worker
just on the
travel
mic.
directive.
Okay, fine. Thank you. Sorry, Heidi.
No, that's okay. Sorry, I hadn't prepared a PowerPoint on the first update for today, so it's a verbal update. We are, in terms of our case count, we are seeing increases in cases every day, and we are continuing to see the presence of the variant of concern in Haldimand and Norfolk. So that is obviously a very concerning situation. We have, related to our agricultural community and the isolation plans for temporary farm workers, there have been plans, safe isolation plans approved for more than 4,000 workers. So the team is working through that process on a daily basis. And then in terms of vaccination, we have administered over 21,000 vaccinations, and there are just over 1,700 people who have completed their vaccination cycle, meaning that they have received 2 vaccinations. We are officially in phase 2 of the vaccination process. So we are processing appointment requests for those who are 65 and older and people who have the highest risk health conditions as determined by the provincial guidelines. We are we're in the process of opening the vaccination site at the Delhi Arena on Friday. So I understand from Chief Page today that facility is all set up and is ready to go for Friday. And so that is very good news. And we continue to vaccinate people at Norfolk General Hospital and at the arena in Cayuga. And we are continuing to work in partnership with our hospital partners, our family health teams, our local physicians, and there are going to be some pharmacies coming on board. So that is a very high level update of where we are at with our COVID-19 response as of today. And with that, I'd be happy to answer any questions before we move to the PowerPoint presentation on the transportation directive.
Are there any questions from board members in regards to the update? Councilor Martin, go ahead. Board member, sorry.
Thank you, Chair Chop. Through you to Heidi. So if you were to, out of those 3 priorities, like how is the time and resources spent from our health unit team to break up those 3? And at what point in time do you stop working on one and focus on another? Because I can only imagine there's peaks and lulls in all things, but you know, how are you actually prioritizing that?
So thank you, Madam Chair, through you to Member Martin. Right now, our team is working at, quite honestly, beyond max capacity on all 3 priorities. There are particular pressure points in case and contact management due to the increased numbers of positive cases that we have seen recently. As well as as we move into phase 2 for vaccine and as additional people become eligible to receive their vaccine, we are ramping up the vaccine program to, as I said, move to the larger site and be able to increase the number of people that we can vaccinate per day. I am meeting with the team on pretty much a daily basis to look at what our resource pressures are and how we can address those pressures, either by reviewing our processes and making sure that we are always focusing on the essential tasks and duties in each of the priority areas, and then reaching out through our Emergency Operations Center for additional resources as required.
Thank you. Through you, Chair Chop, my second question, the vaccination program, the first round of doses that were administered and then the deadline was changed. I've received just a few phone calls, but I'm sure that means the health unit is receiving hundreds of phone calls about that second date now that the deadline has changed. Would you be able to make a comment on that?
Certainly, through you, Madam Chair, to Member Martin. The province has, for most people receiving the vaccine, the province has changed the interval between the first and second dose to 4 months. When that happened, we sent out, we have done regular media communications, and we have sent out automated messaging to let people know that their second dose appointment, if they had one, has been canceled, and that we will be contacting them to book that. Some communities have been automatically booking at the 4-month interval. We decided to pause on that and contact people to rebook. We're not anticipating a change in direction, but you know, if by chance there was change in direction, again, looking for efficiencies, we're tracking the number of calls per people we need to make. So if we only need to make 1 additional call as opposed to 2 additional calls, that reduces time on that task. There are some individuals who, residents in long-term care and retirement homes, they account for the people who have received 2 doses as per the provincial direction to stay with the 21 to 28 day interval. And as per provincial direction, people with highest risk health will be booked for their second dose at the 21 to 28 day interval. And that will be identified at the time of registration at the vaccination clinic. So those who are eligible for a second dose in 21 to 28 days will have that appointment when they leave the clinic. Others who are will be receiving their second dose at or around the 4-month interval, we will be contacting to book those appointments.
Member Huffman, go ahead.
Thank you, Chair Chop. Through you to Heidi. First off, Heidi, I want to, again, I'll say thank you for all of the hard work that your team is doing. I can only imagine the circumstances that everyone's working under. So everything that you're doing is much appreciated. A couple questions. One, when will you know when the pharmacies come on board?
So thank you, Madam Chair. Through you to Member Huffman. There have been 3 pharmacies that have been identified in the Haldeman, Norfolk area, and they're being onboarded now. It has been shared publicly that and one in Dunnville, and so my understanding is that the province is working with them directly to ensure that they get the vaccine supply, and they have a separate booking system for appointments at the pharmacies.
Okay. And do you anticipate that with the pharmacies that this will help alleviate going into the latter part of phase 2? Will that be a benefit to us, I guess?
Yes, through you, Madam Chair, to Member Huffman, I do anticipate that the pharmacy, anyone who's 55 and older is eligible to book an appointment through the pharmacy, and the pharmacies will be doing the vaccine. And so if people are eligible for that, if they meet that age cohort, certainly we would encourage them to use that avenue as well as a way of getting their vaccine.
Okay, all right, thank you. And my next question is, I noticed that this week across the province, in particular, I know there was one, I'm not sure if there was a couple other ones, but I know that some schools had decided to shut down. One was under a Section 22 order. I was just wondering if there had been any discussion from Dr. Nesethari in terms of implementing a Section 22 order regarding our school system.
So, Madam Chair, through you to Member Huffman, at this point we have not had that decision. To date, we have followed the provincial direction related to school closures and openings. We have had some schools that have moved to online learning, and that is specifically due to outbreak situations in the schools. And that's been a decision of the school board.
Okay, all right.
That is separate from the communities that decided to issue a Section 22 to shift all of their schools to online learning.
Okay, all right. Thank you very much.
Member Columbus, go ahead.
Thank you. And Heidi, I've heard you use the word "we" several times. Can you tell us, just share with us, when you say who all is included in the "we"?
So, Madam Chair, through you to Councillor Columbus, when I'm referring to the word "we" as we talk about the vaccine program specifically, certainly the health unit, Chief Sarah Page has been redeployed as our vaccine program coordinator. We are also working in partnership, as I said, with our hospitals in Haldeman and Norfolk, our family health teams, and family physicians.
Thank you, Heidi.
And of course, included in the health unit is Dr. Nasathare, our medical officer of health.
Just to follow along on Councillor or Board Member Martin's question, Heidi, in terms of that prioritization, I mean, you know, we've seen in Toronto that since October, they stopped doing any contact tracing, and that people were responsible for it on their own because they simply didn't have the resources to be able to manage that. Now, with the variants of concern, there was a statement put out yesterday, I believe, that said that, you know, the health unit now was going to engage in contact tracing, but only if it involved those variants of concern. You know, the vaccination program remains a priority for them since the contact tracing has taken the back seat. You said that there's no particular order to our priorities here in Norfolk County. Is there a reason that we haven't prioritized like the Toronto Board of Health has? I know, again, I know it's not yourself, but it's speaking, what knowledge you have from Dr. Nasathare.
Certainly. So, Madam Chair, I know that, and in saying that, I know that Norfolk County has corporately prioritized the COVID response, and within that has identified that the vaccine program is the highest priority, and certainly in terms of our long-term movement beyond the pandemic, that is how we get there. And so we're not, at this point, we are able to continue with all three of the key priorities that the health unit has been identified for the health unit, as I've described. Certainly, if it became, when there are resource pressures in one of our key priorities, the first thing that I have been working with the team over the last couple of days on is to identify, are there process changes or are there resources that we can add or shift around without taking from another priority and without destabilizing the response. And so certainly we have not moved resources from when we started the vaccination program. We dedicated resources from other priorities to the vaccination program so that we could get that program up and running and rolling. Those resources remain with the vaccination program today.
Okay. So what you're saying is a priority to the three key priorities that you listed. There is a hierarchy. My concern is, I know everything's going okay now, but as we see variants of move into the community as the migrant farm workers arrive. I guess maybe Jill, this is a question for yourself. Under the Health Protection and Promotion Act, Section 4, Section 5, the board does have responsibilities as well. And in terms of how do we ensure, or do you believe that the board has the ability to, establish what we believe are key priorities for this health district? So if resources are limited, like they were in Toronto, I mean, we're a much smaller unit than public health, and they've seen resource constraints. So as we move into the summer season, do you believe it's appropriate for the board to communicate to the public health unit, what we believe those priorities should be? I.e., vaccinations should be a top priority for Haltom and Norfolk, if that was the feeling of the board.
So I guess I should preface this by saying that I sort of I had attended here on the basis that there might be questions to field relating to the instructions. So I'm not really kind of fully briefed on the issue of jurisdiction to prioritize, which I take as your question. But I guess what I would say, nevertheless, boldly venturing forth, is that as I understand what Heidi has said, it sounds to me as if the effort that's being undertaken by the health unit is to remain fluid and deal with all of their priorities. So in other words, if there is a need to staff up the vaccine rollout component, so to speak, of those priorities, that's something that has been done in an effort to try and shift resources to wherever they are needed most urgently at a particular time. And so, and that is, I would say, less a legal question than a public health staffing question. And so it might be more in Heidi's bailiwick than mine to talk about that as a, at a practical level. But if I think about it sort of historically, I remember that, when the issue of, for example, dealing with migrant farm workers in the wake of last year's order was being handled, I can recall that there were resources shifted over to dealing with isolation plans and then shifted back once that was handled. So all of which I would certainly refer to Heidi in terms of how the health unit is handling sort of juggling those priorities, because I think it's less a legal question than a practical and public health question about how you're going to sort of allocate your limited resources to dealing with whatever the most pressing problem is, at the moment, contending with the pandemic. So I would defer to, Heidi's public health expertise on that and her experience with the health unit.
Yeah, no, I think they are juggling it right now. My concern again is moving forward and at a certain point, our resources are already constrained. I think, Heidi articulated, you're working beyond capacity at the moment. So it only takes one additional stressor here to put one of those areas of priority into a compromised position. So again, it's just again, we have responsibilities under the HPPA, and I think we have beliefs of certainly myself as the chair of the board, that the vaccination rollout, should be a top priority here in Haltom and Norfolk, as it is in other locations. Board Member Martin, go ahead.
Thank you, Chair Chop. Not so much a question, but I really wanted to build on something you just said for information I guess specifically to Jill, that the Board of Health hasn't necessarily passed motions or given direction either for those reallocations to occur. And so from my personal position, when I sit here and ask questions of prioritizing, I have concerns that maybe my priorities won't be the same as Heidi's, and Heidi then reallocates resources to something that is less of a public safety concern, as opposed to, I would agree with Mayor Chop, vaccinations should be a top priority. So historically, we haven't sat here as a Board of Health and passed motions and given direction for staff to make those judgment calls on where resources are going. And I think that that's probably something critical. And I don't know if there's any merit in it. I'd be interested in Board Chair Chop's comments, but should we be passing motions and giving directions? I know that's kind of what she's asking you, Jill, but what our priorities are, and should we be spelling them out fairly clearly?
Heidi, go ahead.
Thank you, Madam Mayor. I just want to ensure that the board is reassured that the vaccination program is a top priority for the health unit, that it has been and will continue to be a top priority, that we are planning for increased clinics, increased sizes of clinics, increased numbers of people that can be vaccinated on a daily basis, and that there have not been resources that have been taken away from the vaccine program and allocated to other priorities. So just to give that reassurance.
Okay, thanks very much, Heidi. That's great to hear. Did you want to move on with the presentation with the migrant farm worker directives?
Yes, absolutely. I believe that Jacob from Clerks is going to share his screen and help me by navigating through the PowerPoint deck. So the first slide really just reiterates what we've been talking about, which is that our goal in this pandemic is to best utilize the resources that we have to manage the competing, not competing, but the priorities that we've been talking about. So Jacob, if you could go to the next slide, please. So in terms of the 2021 farming season to date, so we have had 7 farm outbreaks so far related to bus transportation, and that has been assessed and identified through the contact tracing and case management process, resulting in 10 positive cases, 132 workers in total being monitored, and a total of 22 farms being affected. Jacob. So the next few slides just talks about the process for international travel. So the first one is regarding Canadians that are arriving via international air travel. So that we know that people need to provide proof of a negative COVID-19 test prior 72 hours before their departure. Once they arrive in Canada, they need to complete a test before leaving the airport, and then they receive a 10-day test kit for a second test on day 10. And they're required to isolate in a hotel at their expense for 2 to 3 days. And then Jacob, if you can, and actually Jacob, if you could go all the way to the end of this slide. So if the test result is negative, then the person is able to leave the isolation hotel and complete the remainder of their 14-day quarantine. They complete the second test on day 10. Test kit and are able to exit isolation once they have a negative 10-day test and the 14-day period is over. So in terms of how this process works for Canadians positive, then they need to remain in the hotel room until the public health unit calls with further instructions. And we manage the case through our contact tracing and case management program. How this process works for our temporary farm workers. So again, similar that they have been completing their test at the airport and receiving a test kit for the 10-day test. Prior to the medical officer of health instruction related to travel, we were seeing farm workers transported on buses or vans or other types of congregate type of transportation, often covering more than one farm, and then going to their isolation location. And usually we would receive the test results from the airport test 2 to 3 days afterwards. If the test result is negative from the initial, then the second test is required on day 10 using the test kit, and the person can exit isolation once the negative day 10 test results are obtained and the 14-day period is over. And then if the test result is positive, then that's where we see increased work coming on the contact tracing and case management from that perspective, where we have to identify all others who were traveling together as close contacts from the airport, and we have to institute case and contact management plans from the health unit perspective for each impacted farm. And so really the purpose of the overall instruction is to minimize the risk of the transmission of COVID-19 and minimize the risk of outbreaks. When we have outbreaks, it's a considerable, first and foremost, it impacts a greater number of people and puts them at risk of getting sick. It also requires significant resources on the part of the health unit to manage these types of situations. And you can see the list here on this slide, including regular outbreak management calls with the farm operators, monitoring calls to people who have tested positive in close contacts to do wellness checks, and also supporting and reviewing the safety plans and the isolation plans on an ongoing basis, and then working to facilitate medical care for people who are sick or who become sick. So this provides hopefully a little bit of context for the direction. I can try to answer questions as best as I can. If there are questions that I'm not able to answer today, then certainly I will take note of those and consult with Dr. Nesathare and provide a written response. And with that, I'd be happy to answer any questions.
Sorry. Questions for Heidi from the board. Councillor Van Passen, I think I saw your hand first, and then Councillor Columbus.
Yes, thank you, Madam Chair, and through you to Heidi. You gave us some statistics of outbreaks related to buses, and I just wonder what kind of data that you had based that on, like these individuals that come up here to work on our farms. You know, they spent 24 hours together at an airport in their source country. They've spent 8 or 10 hours on a plane together, and you're putting the blame as the hour-and-a-half bus ride from Pearson Airport to the local farm in Norfolk County where do you make that leap to get that conclusion?
So through you, Madam Chair, to Member Van Passen, in my discussions with Dr. Nasathari, he has indicated to me that through the case investigation process, that the transmission of the virus has been linked back to the bus travel. Certainly, I can take that back and ask for more specific analysis on the steps that have been taken in that investigation process to make that determination. But it has been communicated to me that the source through the case investigation process, the source of the transmission, has been linked back to the bus travel.
And if I could, Madam Mayor, just as a follow-up to that, you know, some of the debate with the latest direction is, you know, there's two options: that the farmers have a bus, the bus driver is isolated from the group with plexiglass shields, the bus driver is wearing an N95 mask. They put the workers on the bus, they stagger the seating, every worker is provided the N95 mask, every worker has a face shield, every worker is 2 meters apart, 12 workers come home on the bus, but that's not allowed. Now we have to send 12 different individuals, each to pick up one worker, and I want to know what kind of data efficacy details or medical things that we base that decision on why it's better to put 12 people exposed to potential COVID rather than one. And if maybe, I don't know if you could answer that or follow up to try to get a little bit more detail on that for us.
Certainly I can follow up and get more detail. As a beginning to the answer, I would say that the direction is really related to having the workers travel from the airport to the isolation site in their isolation cohorts. So if they are isolating individually in a hotel, then the direction is to travel individually. If they're isolating 2 or 3 in a bunkhouse, then the direction is to travel in that isolation cohort. But I do understand your question, Member Van Passen, and I will take that back for a more detailed answer.
Jill, I just, if I could ask a question here quickly before I move on with Councillor Columbus. I just want to ensure, I mean, I've read as well, what is it, Spring of Fear in the commission report post SARS. I just want to understand that you know, is it your belief that, you know, for the board to ask some of these questions in regards to this directive, are we within our boundaries here?
Well, the structure of the Health Protection and Promotion Act, you know, certainly contemplates that the medical officer of health is going to, on a regular basis, you know, provide this type of information relating to the public health initiatives that are being taken to the Board of Health. And, you know, that's been regularly done by way of various PowerPoints and attendances at Board of Health meetings and so forth. What I would say is that the actual, how would I put it? The actual epidemiological analysis that underpins an instruction and the, you know, kind of public health rationale for, you know, for the type of instruction is really something that, at least historically under the legislation, has been the role of the medical officer of health and certain other health unit staff, simply because the structure of the legislation, as you know, is that every Board of Health has to have a medical officer of health, and the medical officer of health has to have a whole host of qualifications, which are, set out in various regulations, and that are like it's actually a subspecialty that in effect is policed by the College of Physicians and Surgeons. So all of which to say, I think that the structure of the Act is to rely on the medical officer of health and the sort of medically trained staff at the health unit to do that sort of, kind of epidemiological analysis of, what sort of instructions or orders should be made in order to deal with, for example, a communicable disease. So that's a long-winded way of saying, I suppose, that the legislation certainly contemplates a role for the Board of Health in terms of understanding what the initiatives are that are being taken, and it certainly contemplates that the medical officer of health will relay that to the Board of Health, but it's also structured in a way that assumes and in some sections requires that you're going to defer to certain kind of medical decisions to the medically trained staff.
Certainly, I guess that's that's at the heart here. We have and we do, and I certainly have, and I think you saw me throughout the the appeal and support. And I try to look at it from all perspectives and understand the logic that's being applied, even if I don't always agree with it. But I think there comes a point when I have to believe that the legislature couldn't have intended that, you have a Board of Health that can't ask questions in relation to directives when it doesn't make sense, because ultimately we are the face that's accountable to the public here in Norfolk County and our community. And so, again, I just want to make sure that, that you didn't think we were offside asking some questions, because I have a couple as well. I mean, I've tried to see the logic in all instances, but I do, like my colleagues on the board with the travel directive in particular, there are certain elements of this that I'm having trouble, getting past. So I just wanted to make sure we weren't offside here asking for some questions and first some further clarification coming back to the board, realizing that we have no ability to change that order or to overrule the directive in any way, but rather, looking for some more background to help the Board of Health understand the basis for the order or directive.
The other thing that I would say, Madam Chair, and it really goes back to your previous question about prioritizing between competing priorities for a health unit. So, for example, between the vaccination program and dealing with contact tracing was the one that you identified. And I mean, Heidi can correct me if I'm wrong, but just on a sort of plain read of this instruction relating to transportation of temporary foreign workers, it reads as an instruction that in part is designed to ensure that, kind of the dealing with contact tracing and managing outbreaks arising from problems that occur by reason of workers being transported in large groups, doesn't siphon away from the resources that are available to focus on things like other outbreaks or managing the vaccine rollout. And so it's, according to the kind of explicit wording under the rationale, it talks about, you know, the health unit having to initiate case and contact management and deal with farm outbreaks. And that's sort of part of the rationale for putting this in place so that those resources are available to deal with the vaccine rollout. But I'm kind of treading into territory that is not legal, so I will back away quickly from that and
That's okay.
and
No,
put myself on mute here.
I understand what you're saying from a resource management perspective, particularly with, you know, the high resources that are allocated to contact tracing, understanding that the migrant workers that have traveled from the airport on a bus, regardless of whether they were individual or separate, the numbers of people that have come in contact with them for contact tracing is very minimal. It would be allocated to those particular individuals. If 10 workers were going on a single bus to a particular farm, I think in the context, one of the concerns that I have, you know, I'm sure read about all the cab drivers that have died from, contracting COVID-19. So, you know, in the case of our farmers' concerns, and mine as well, as an example, if you had 10 workers that have arrived that would have been exposed to one individual bus driver, are now exposed to 10 separate cab drivers from the, you know, Toronto area. To me, that increases the amount of resources that are required for contact tracing in the event that a worker comes in contact, because now you're worrying about the cab driver that has had many contacts. And so that's where this argument doesn't hold water for me. I think that we are exposing the workers to a greater level of risk than we otherwise would be. And again, recognizing the board has no power to change that. But at what point, you know, do we get to voice our concerns without, without fear of reprisal here as the Board of Health?
Madam Chair, what I would say is, I can't sort of comment knowledgeably on the medical and kind of epidemiological analysis that went into this. So I'm not trying to duck the question. I just don't, I've been very recently asked to step in on this. I don't know the background, and so I'm very reluctant to sort of wade in and talk about it. I'm sure Heidi has a lot more information that she can provide in answer to that question than I could, and Dr. Nesathurai as well. So I'm going to, not shinny out on that limb and start expressing medical opinions on it, because I simply don't know the underlying analysis.
No problem. Again, I guess that was just my confusion. I wasn't really understanding sort of the role today of your arriving, and I do respect your opinion very much. So that was why I kind of just wanted to pose that to you. But I understand the challenging position you're in. Councillor Columbus, or Board Member Columbus, my apologies.
Thank you, Madam Chair. And my question is with respect to the farm visits by the OPP and disobeying the signs that accompany the laneways, whereby the OPP are visiting bunkhouses without making a phone call first. Heidi, you've heard about this problem. It's you told me it was a federal quarantine program issue. Have you had many complaints about it, and how is the health unit actually handling that situation? The concern is that the OPP may be spreading the COVID if in fact there was a worker at one bunkhouse out of the 9 that were visited that morning. Can you comment on that, please?
Madam Chair, I see that Mr. Burgess has his hand up.
Yeah, through the chair to Board Member Columbus, we're actually putting out a joint statement with the OPP. We have received a number of questions, Member Columbus, on this issue. Both Norfolk County and the OPP are required by federal authorities to act on their behalf. And when the federal authorities put a service call in, we we undertake that service call under the Federal Quarantine Act. All the public health inspectors or bylaw enforcement officers or the OPP take measures and protocols in place to ensure that they maintain social distances and don't become a vector for disease. So I appreciate the question, and there has been a number of questions, Councillor Columbus, come up through the system, and that's why jointly we decided to put a public release. I think the public release is going to go out later today or tomorrow. It just got cleared through, or it's just being cleared through communications now. So there'll be a bit more on that for the public.
Member Michelle, go ahead. Sorry, Member Columbus, maybe you were frozen there. Was there something further? I just see you moved.
No, I was just thanking Mr. Burgess for his comments.
Go ahead, Member Michelle.
Thank you, Madam Chair. Just to add to Councillor Columbus's question, and I appreciate Jason's response to that. I'm hoping and also wondering, because I believe that, like Board Member Columbus, and I'm sure many of my colleagues, I got a lot of emails and calls about those visits. I'm particularly concerned, and I hope that maybe this could be addressed, and I'm not sure if this is for Heidi to take back to someone or if it's for Jason to perhaps include in the release, but and I'm speaking now on behalf of some constituents and general members of our farming community, that those visits were particularly done on Good Friday, and many of those farmers felt that that was a very disrespectful thing to do, and to do it unannounced, and that they were being treated as though they were perhaps doing something wrong or were in violation of some kind of protocol or requirement. And it was also, they felt that it was perhaps of the entire Christian calendar year, that day is considered to be the most holy, and that was the day when police officers were attending those properties, and also, as Board Member Columbus mentioned, perhaps compromising the quarantine of those migrant farm workers in those bunkhouses, and I have to admit and believe that I do agree with those farm community. I felt it was disrespectful, it was intrusive, and frankly, on that one day, I thought it was quite unnecessary. Thank you.
Councillor or Board Member Martin, go ahead. We're going to have to wrap up here soon as well. We've got the public hearings at 3:15, and if Jason wants to provide us an update later in closed session, we'll have to adjourn and reconvene, or we can schedule another Board of Health meeting for next week as well, whichever the members prefer.
Sure, thank you, Chair Chop. I guess very quickly, if I could the OPP, I think they'd rather be doing a lot of other things than that check as well, but they are mandated to put a response date and a response time on it. And I did see some information in a couple emails flying around about overtime going and doing these checks on Good Friday, and that's not the case. It's just a part of the regular duties from the federal government. So I think some messaging will be well timed on that. My question is, I have a couple questions. So very quickly, Jill, through you, Chair Chop, are you able to elaborate on the difference between an order, a direction, and an instruction?
So through Chair Chop to Member Martin. So let me get my notes out, because I spent last night going through the Reopening Ontario Act, and the previous Emergency Measures and Civil Protection Act and the regs under that act. And so
and to expedite it for you, I think we're all, because we're short on time, we're all familiar with what an order is. So maybe just direction and instruction.
Yeah. So, so they're not defined terms under under the legislation. Basically, as you know, the current legislation is the Reopening Ontario Act, and then you have the regulations that establish the rules for areas in stage 1, and a separate reg that establishes the rules for areas in stage 3. And of course, Norfolk has been in both categories over various periods of time. But both of those regulations have the same general compliance provision that requires that a person responsible for a business or organization that is open shall operate the business or organization in compliance with the advice, recommendations, and instructions of public health officials. And so if you go to the Health Protection and Promotion Act, those are not defined terms. If you look at what other medical officers of health have been doing, so for example, there have been instructions issued by medical officers of health in Ottawa, in Peel, in Halton, in the city of Toronto, and they've all issued instructions pursuant to essentially those regulations under the Reopening Ontario Act. And the approach that the courts have taken, there've been, without going into it chapter and verse, there've been a few court cases that have looked at the issue, and the approach that the courts have taken is, I would say, a sort of non-technical approach to just basically say, look, the Reopening Ontario Act and the rules relating to that are set out in the regulations are to be given a large liberal remedial interpretation that is designed to accomplish the goals of the legislation, one of which is to protect the public health. So all of which to say they've not, so to your question, they've not taken a technical approach and said, well, what does advice mean? What does an instruction mean? What does a direction mean? They have treated these type of public health measures as falling under the broad power established under these regulations, an instruction that has an aim to deal with a public health issue arising from COVID in the health unit.
Okay, thank you. Earlier you commented on the epidemiology, questioning that too much. I guess just in response to some of your comments, under the Reopening Ontario Act, there's an actual study that's cited about case and contact management, and it specifically references school buses and children on school buses. So I'll leave you with that, but I think it's not apples to apples, but it is specifically mentioned in there, and I think it's noteworthy for the transportation aspect. My second question is just a very quick clarification for Heidi. On page 3 of your presentation, I may have misunderstood you, but did I hear, it does kind of read as such, but is it fair to say if an airport test is negative, do the workers stay in that room until the day 10 test, or are they permitted to come and finish off isolation in the bunkhouse?
So, Madam Chair, through you to Member Martin, when workers arrive in Canada, they take a test at the airport, and then they go to their isolation residence that has been approved in their isolation plan. So it might be a hotel, or it might be a bunkhouse with up to 2 other workers. The federally required hotels are for international travelers coming to Canada who are not temporary farm workers.
Thank you.
Okay, Member Van Passen, you're gonna have to make it quick because we really need to start the public hearings, unfortunately.
Thank you, Madam Chair, and I will be quick because I don't expect an answer, but it's something they can follow up. I'd like to know what kind of data do we have that makes Haldeman Norfolk different than every other jurisdiction, and why, our treatment of the foreign worker program coming here, why is it different? What facts do we have that make our health unit different than the other 33 across the province? So if they could bring a little bit of that data back at some point as well. Thank you.
Madam Chair, I have noted that question.
Thanks, Heidi. Okay, so thanks very much, Jill, for joining us.
Well, thank you very much for allowing me to join. To recognizing that you've got like 1 minute. To Member Van Passen's question, the things that that makes this health unit different is that there are more migrant farm workers than any other health unit in Ontario, and so the issue of dealing with a significant migrant farm worker population is something that other health units don't have to struggle with to the same extent. So I would, and I only offer that because the court spent a lot of time grappling with that evidence the last time around. So I just throw it out as something that is off the top of my head, but I defer to obviously the professional staff in the health unit for that information.
I think Windsor Essex actually has more. We just have more on a per capita basis. Okay, if anything else from the board at that point? All right, thanks again, Jill. So I guess this next question is to the board very quickly. Obviously, we need to get into public hearings. You have received the communication from BLG as well as the update that was provided by our CAO. I'm not sure if there is a need to go into closed session today, or if we look to, as soon as we get some additional information, we could call a subsequent Board of Health meeting for some time next week if necessary. But that I will defer to the board here very quickly to make a decision on that matter. So that'll just depend whether we pass a confirming bylaw right now or we move to simply adjourn until later this evening. I know Member Columbus has to leave at 6:15 to go and chair the LPRCA board meeting that coincides at the same time.
Do we know when we will get some additional information?
Through the board, or sorry, through the chair to the board. I'll provide another piece of information later tonight, and we'll, there is not much more to, we may have some additional information next week.
Member Martin, did you want to? Any further thoughts then beyond that?
I kind of do have one burning closed session question that I might like to put to Board of Health members.
Okay. Member Michele? You're on mute there.
Sorry, Madam Chair, I'm now with you. Just a procedural item. If we go to a confirming bylaw, we have not yet adopted or corrected the previous board meeting minutes. So I'm just wondering if we should do that too.
We've run out of time here, unfortunately. That's the problem. So we can't always adjourn the meeting and do those at the next meeting. Member Van Passen, go ahead.
Thank you, Madam Chair. Could I make a motion that we recess the meeting till after and deal with it very quickly after the Public Hearings Committee, and whether we decide to confirming bylaw, but we don't have time to do that, or we're going to be in violation of the Planning Act. So
Okay.
I'd make a motion to recess.
All right, that sounds good. A seconder. All those in favor? And that's carried. I guess, Kevin, if you wanted to let everybody in that needs to be let in.
I'd like to request
We
that
got a
everyone
meeting
mute
here, Wendy.
themselves.
Sorry, we're waiting for virtual. Okay, sorry about that.
Okay.
Okay.
I think we're gonna have to sign off, Joe.
You got Rob?
So everyone's been admitted that was in the lobby for public hearing committee.
Councilor Michelle, is your hand up there for a reason?
No, Madam Chair, forgive me.
Okay, with that, I will now call to order the public hearing committee. Any declarations of pecuniary interest? I've lost a couple council members. I'm not even sure we have quorum here right now. Okay, Councilor Martin is back. Any declarations of pecuniary interest? Okay, seeing none, I now officially open the public meetings held under the Municipal Act, the Planning Act, and County Policy. Please be advised that to preserve your right to appeal to the local planning appeals tribunal, you are required to make comments or provide written submissions prior to the passage of a bylaw. It is important to note that no final decisions are being made on these matters today. These meetings are to allow the public to provide initial comments, and further reports will come forward to council at a future date. First is staff report CS 2119. It's regards to a request for closure and conveyance of all Tolman Street and part of Russet Street in Delhi. Lydia, is that you presenting this report?
Yes.
Could we get an approval to the agenda?
My apologies. Somebody could approve the agenda. Councillor Martin, seconded by Councillor Huffman. All those in favor? That's carried. Lydia, please go ahead.
Yes, thank you, Mayor Chop. Before I begin the report, I just wanted to give a short explanation to how the reports are set up. There is report CS 2119, which I'm going to speak on right now, and also CS 20. They're done as separate reports because 2121 deals with a subdivision development and is also tied into the subsequent report that will follow the road closures, but they're all in relation to one area in Delhi. So just so that we can understand that. I am also going to share my screen and put some mapping in place that might make it a little bit easier to follow. I'm hoping everyone can see the mapping. Okay, so this report is being presented to council with respect to the applications by multiple property owners to acquire adjacent portions of Tolman Street and Russet Drive in Delhi. Both Tolman Street and Russet Drive are unopened streets on Registered Plan 334. The property owners have maintained the respective portions of the streets for many years and are now applying for ownership of the respective parts. The area is within the urban boundary of Delhi and qualifies for the urban valuation of $1.25 per square foot. The property owners are requesting a reduction in this valuation due to the fact that their properties do not have municipal services such as water, sanitary, and storm sewer, and no curbs and sidewalks. A table has been included within the report to reflect the various valuation options that council may consider. However, to remain consistent with the council-approved valuation, staff are recommending the lands be sold at the $1.25 per square foot valuation. The property owners will be required to pay all of the costs associated with the road closures, and those costs will be shared on a proportionate basis. With that, I will take any questions that council may have.
Thanks, Lydia. Any questions from council members? And I can't see everybody right now for some reason, so just speak up if you have a question at the moment. Councillor Columbus, I see your hand there now.
Yes, Lydia, will the existing homes on McIntosh and Duchess, will they retain their same addresses?
Through the mayor to Councillor Columbus, thank you for that question, Councillor Columbus. I have made inquiries to our GIS department on that matter, and I've been told that yes, they would keep their existing addresses. The numbers do go higher as you go, and it's the south portion that are going to be developed. And that will be something that would be addressed through the subdivision agreement as well. The developer will have to apply to GIS for those addresses.
Thank you, Lydia.
Any further questions from council members? I see that we have one speaker on the report. Bob Phillips from Cahoon Engineering, are you with us?
Oh, Madam Mayor, I think Chris put his hand up there.
Councillor Van Passen, I just see that now. Thanks, Ryan. Go ahead.
Thank you, Madam Mayor. Just a question to Lydia. We have some debate and there's some comments about the valuation per acre, but I think I'd have a hard time going and finding a 1 acre lot anywhere in the rustic rural countryside in Norfolk County for under $200,000. And if I do my math correctly, that's about $450 a square foot. And here we've got the council approved valuation of $1.25 a square foot, and we're getting complaints that that's too high. And I'm wondering, I don't know if I'm mixing my apples and my oranges, but maybe it's time that we reassess the valuation per acre of $50,000 for lots as our part of our policy. But I don't know if you have any comments on that or not.
Through the mayor to Councillor Van Passen, certainly if council wished the staff to reassess the valuations, we can certainly reach out for an updated appraisal. I think it's been years since we did have an appraisal done for valuations for road allowances and streets. And certainly we could have that updated to see where it sits today. Should council direct that.
Councillor Columbus, I see your hand still up. Did you have something else to add?
Sorry, I meant to put it down.
No problem. Okay, Mr. Phillips, are you with us?
Yes, I am. I did not have any comments with respect to staff report 21-19. I was going to wait till 21-21 and or 21-18, which follow.
Okay, sounds good. Thank you, sir. And I believe we have one registered speaker. Robert, are you with us? Right to pronounce the last name because I think I'm going to get it wrong.
Yes.
All right, so you have five minutes for your deputation or your comments to council.
Oh, well, our properties are north of Tolman Street, and we have a private drainage system here that we share with an easement. And we noticed that the drainage problems have been getting close to our properties. So our primary concern is that the section of Tolman Street that's adjacent to our properties be somehow preserved or protected to prevent any further well, any drainage towards our private system, because if someone else were to acquire the section of Tolman Street behind us, they could effectively grade the property to be draining into our private system, which is not to be permitted. So our primary concern is to protect our drainage system. We don't get really any usable benefit from this property behind us. It's separated by a 46-foot easement and a hedgerow of huge evergreens. So we're saying that was the town going to do anything to protect our drainage system? We're essentially being forced into participating or buying it. We really don't want to buy it. We want to preserve it. And if we have to acquire it somehow to preserve our drainage system, that's our concern for two of the properties north of Tolman Street. And also, there is a situation with the first dealing exemption that several of the properties have, and adding Tolman Street to the existing properties would be a first dealing at the registry system, and that would be a result in the loss of the actual exemption. In the case of Helen Mosbacher, she plans on using that first dealing exemption, and it would be a minimum cost of $12,000 right there that would be incurred later on in the future when her estate is transferred. So there's already on her section would be even if the properties were the sections were added at no cost, there would be a $12,000 cost there. So we have those two issues, drainage and future costs with the first dealing exemption. We're wondering, can council somehow preserve the first dealing exemption for those properties that have it? Or could the actual transfer of this section of the property happen in the future when the estate is transferred? But a big concern, that's a big concern, and obviously a big concern is protection of our private drainage system.
Okay, thank you, sir. Is there anyone on from Public Works, or Lydia, if you had any comments to that end, and if not, we could include that with the subsequent report to council?
Through the mayor to council, what Mr. Mosbacher is referring to is in regards to at the time of estate conveyancing. And I will tell you, I'm not a specialist in estate conveyancing, but I do understand his concerns with regards to first dealings, and this is something that is relatively new due to the land titles scenario. I will also advise council that when I did meet with the property owners some time ago, I did advise that they seek legal advice on, acquiring or not acquiring these lands. And certainly what Mr. Mosbacher is asking about is something that would require an opinion from his lawyer. I can't speak much more to that. It would be out of my realm to do that, but I certainly advise the property in what we would be doing here. In regards to the easement, yes, there is an easement that is registered on title. It is along the southerly 46 feet of the properties that front on Cortlandt Street. That easement is in favor of Norfolk County and is there for to facilitate the maintenance of the storm drainage system that's in place there. It isn't on Tolman Street. It is on the private property owner's lands. And that was put in place when those 4 lots were created, or 4 parcels were created some years ago.
Okay, any further questions from council members? Again, if somebody could put up their electronic hand, I'm just with the presentation. Councilor Columbus, please go ahead.
Yes, the question has come up. What if one of the parties are not interested in purchasing the property that's abutting their existing property?
Through the mayor to Councillor Columbus, that does occur on occasions when we do have multiple property owners like we have today. And what we would generally do is we would go forward with those property owners that wish to purchase, and we would then delay on the other parcels until perhaps another owner comes onto the scene and buys the property and then makes an inquiry to the county about purchasing the adjacent portion of the streets behind them. So in effect, we would wait it out until a new buyer comes along.
Okay, thank you for that.
Any further questions from council members? Councillor Van Passen, go ahead.
Thank you, Madam Chair. As a follow-up to Councillor Columbus's question, but I had one sort of along the same lines, but I do believe this is a whole package deal. It's an all or nothing deal. And is it possible to get signs offer of purchase and sale from each and every one of the property owners before we contemplate closing the road?
Yes, through the mayor to Councillor Van Passen. In the past, Realty has not put, property owners into agreements of purchase and sale when we're selling portions of our unopened road allowances and streets and that type of thing. But it is something that can be done, absolutely, yes.
Further questions from council members? Councillor Van Passen, or I guess I'm not really sure, because Lydia, how is this going to come back then?
Yes, through the mayor, this would come back, I guess, as a report to council at a future council meeting. What I can do after today's meeting, of course, is I can reconnect with the property owners and see who is in favor of moving forward with an action of the streets adjacent to them, and I guess in favor. And if we, end up with probably, where it's hodgepodge, and we'll have, parcels in the middle that won't be being sold and conveyed to the adjacent property owners and leave us with small landlocked parcels, then it would likely be possible that we'll have to consider holding off on this road closure and sale until we can get everybody on side to purchase the lands. If there are parcels that are in the center of the road allowances and streets that can be sold and won't inhibit the county's access, if we need to get into any of the ones that won't be sold, then we could go ahead and sell the ones in the middle that wouldn't require access to.
Lydia, would an option be for, as an example, if there were, would an adjacent property owner be able to purchase that allowance behind the other property? I mean, it's a pretty sizable portion that you could have I know would make your lot an odd shaped, but again, like Councillor Van Passen said, that makes for a nice property lot size, and that would be a great piece. Somebody could do a garden or something that was off to the side that didn't take up their backyard.
Yes, through the mayor to council, that is an option. However, what we usually like to see and obtain for our file is a sign off from the adjacent property owner that they are not interested to purchase the parcel, and that they would consent to another property owner purchasing it instead of the adjacent property owner getting it.
No, I think absolutely the first right would be to that property owner that backed onto that parcel. But
Yes.
to Councillor Van Passen's point, you know, it doesn't make sense either for us to sell a section here and a section there, and then leave other sections that are likely never to be purchased and left untouched, so that it would be an all or nothing. I mean, it would give the opportunity to somebody else to make their lot even bigger if their neighbor didn't want to purchase their section.
Correct. As long as we can get sign off, we could do that.
Okay. Councillor Columbus, did you have something further?
Yes, I did. Councillor Van Passen had raised the question that these parcel per square foot was undervalued. And I just, my question is, the prices that have been put before the public here, the property owners, we'd be using those. We wouldn't be going at the new rate, would we, Lydia? If in fact you're going to do a re-evaluation of what we're selling at land for?
Through the mayor to Councillor Columbus, I think we would be going with the present rate that we have now, established and approved by council. For us to go out and get an appraisal now, do a report to increase the valuation, and that would take some time. And if we want to go forward with the sales to the adjacent property owners now, then we would likely use the valuation we have established presently.
Thank you. That's what I was concerned about.
Thank you, Councillor Columbus. Does somebody wish to move the staff recommendation or propose an alternative? Again, I'm having trouble seeing everybody with the PowerPoint up, so if somebody could raise their electronic hand, I can see that. Councillor Taylor, thank you. The staff recommendation, and Councillor Michelle, you're seconding that? Okay, all those in favor? And that's carried. The next report is staff report CS 20-21, the request for closure and conveyance of all of Baldwin Street and part of McIntosh Drive, Russet Drive, and Duchess Drive, Plan 334 in Delhi, and a portion of county-owned lands. And Lydia, if you'd like to go ahead.
Thank you, Mayor Chop. I'm just getting organized here. I'm going to share my screen and put the report on the screen for the mapping that's included in there. This report is a little bit more complex than the previous one in regards to kind of the moving around and shifting around of properties here. Okay. So if everybody can see the mapping, that would be great. So yes, report CS 2121 is being presented to council with respect to the application by Joe Jealous for the closing of Baldwin Street and parts of McIntosh Drive, Russet Drive, and Duchess Drive on Plan 334. Delhi, and the further acquisition of a portion of county-owned lands that were to facilitate the extension of Argyle Avenue to the Fertilizer Road for the purposes of the proposed subdivision development for the area. This report is being presented to council in tandem with the planning application report, which will follow. The report is on the screen, and there is some complexity to the request of the lands to be acquired in exchange between the county, the property owner, and the developer. Bluegrass Estates is now in a position to move forward with phase 3 of its subdivision development in Delhi, and requires to acquire a land assembly of parcels owned by David Vandevelde and Norfolk County. The lands to be acquired from Norfolk County include the streets and portions of streets as illustrated on the mapping shown within the report. And I have in front of you figure 1, and that is showing, it's kind of a clip from a draft reference plan. And so what I'll just do is run through this. The lands to be acquired from Norfolk County include the streets and portions as illustrated, and also a portion of land required for the extension of Argyle Avenue. The portions of the streets are again unopened streets as set out on Plan 334 and are owned by Norfolk County and are shown as parts 2, 4, 6, and 9 on the mapping view. The strip of land that extends from the current termination of Argyle Street to the Fertilizer Road, part of which will be required to be obtained by Mr. Jealous. Is shown as part 12 on the mapping in front. The sale of the streets is fairly straightforward request to council for closure and conveyance. The sale of the strip of land, part 12, is somewhat more complicated. That the county does not want to lose its potential for any future access to the Fertilizer Road. Council may want to consider retaining an option to purchase these lands back in the event that Mr. Jealous does not proceed with the Phase 3 development, or the is stalled and Mr. Jealous loses ownership of the land due to default under any mortgage situation. Bluegrass Estates is also looking to Phase 4 of the development as well. And there are some considerations there that need to happen with county-owned lands there as well. Mr. Vandervelde is the owner of a bulk of the unopened lots on Plan 334. And some years ago, his parents sold to Norfolk County the strip of land that's shown on the mapping as Argyle Avenue and also Part A. And the portion that's shown as Argyle Avenue will be going with Phase 3 of the development. But there are some terms and conditions in an agreement of purchase and sale related to the strip of land shown as Part A. And what Mr. Vandervelde would like is for an exchange of the strip shown as Part A in yellow to a new strip to be acquired by the county shown as Part B in green. He would like then to have his agricultural area to be one continuous farm area without the being kind of dissected by Part A. So there is the exchange that has been requested now for those two strips. This exchange of land can be accommodated. However, the county would not complete the reconveyance to Mr. Vandervelde of Part A until Phase 4 of the development is approved and built out and the street system is in place to the Fertilizer Road. The county doesn't want to lose its potential access to Fertilizer Road. We would also suggest that Mr. Vandervelde through a lease agreement for the use of Part A for his farming operations until such time as this parcel is reconveyed to him. Part B will be acquired by the county from Mr. Vandervelde for nominal consideration and will be subsequently then conveyed to Mr. Jealous when Phase 4 of the development is ready to proceed, so that there's connectivity of a road from running south from Argyle Avenue through Phase 4 of the development and connecting to the Fertilizer Road. A valuation table has been included in the report to reflect the various valuation options that council may consider. However, to remain consistent with council approved valuation, staff are recommending the open streets be sold at the council approved price of $1.25 per foot, and that the strip of land that was acquired to be the extension of Argyle Street be sold at the $30,000 per acre valuation that the county paid to acquire these lands from the Vanderveldes in 2010. The property owners will be required to pay all costs associated with the road closures, and county departments were circulated for comments and concerns, most of which will be addressed through the subdivision approval process. There are a lot of moving parts that need to come together for Phase 3 and 4 of the developments to move forward. and the proposed land acquisitions and exchanges of county-owned lands are ultimately required to allow these developments to proceed. And with that, staff will take any questions council may have.
Questions for Lydia? Councillor Van Passen.
Yes, thank you, Madam Mayor. A couple of sort of unrelated questions, but I thought if I look at the official plan that that whole part south of the proposed development, isn't that supposed to be safe for industrial development? And then I'm wondering why we have phase 3, phase 4 and all that as residential when that should be saved as industrial lands.
Through the mayor to Councillor Van Passen, there's a little bit out of my scope, so I would ask for.
I'll ask the question in the next planning report.
Yeah, maybe that would be best.
And the one other question, and it was up on that map, the part, where I've lost it. Part B, the very south end of Vandevelt's farm. Does the county have some sort of infrastructure in there? Is that part of a municipal drainage system or sewer system? Like there are manhole covers on that little strip of land already. So is there some sort of county infrastructure under that strip already?
Through the mayor to Councillor Van Passen, I can't tell you for certain myself. I'm hoping that Mr. Godby is on the meeting as well, and perhaps he could comment on that. I do know that Public Works was in favor of this reconfiguration of the road from Argyle Avenue out to Fertilizer Road as opposed to the straight across configuration that exists at this present time. And so if Mr. Godby's on the meeting, perhaps he could comment on that.
Yeah. Through Madam Chair, to Councillor Van Passen, you are correct. There is it is a municipal drain runs through there. That is what those storm sewer manholes are for, which is one of the reasons why we were supportive of relocation of this road allowance down to that area, because then we could contain all of our infrastructure within one road right of way, as opposed to having to have it going through easements across other property.
Brandon, I see you're on as well. Did you want to address the question earlier about the industrial lands to the south?
Sure, if I may, through the chair, I might as well address it now, and I can confirm that Councillor Van Passen has an excellent recollection of the official plan. The lands south of Argyle are designated protected employment, industrial employment lands, so I would suggest that the schematic shown on the screen within this one is more for illustrative proposed future purposes that would have to be evaluated. In the planning report, we kind of blocked that area out. It would have to be part of a future proposal to evaluate that. The items that are identified in this staff report for the road closure are adequate and helpful to give us that kind of consideration about what might happen with future phase 4, because there is still some uncertainty. So thanks for identifying that.
Councillor Van Passen, did you want to go anything further?
Well, just, if it's a potential plan, if we did the trade for Part A or Part B, which I think everybody agrees is a good idea, then there's the little void between the end of existing Argyle Street and the beginning of the new Part B. Is that something at some point, whether that is those intermediate parcels get developed some way, whether it's industrial or it's residential, that we will have a right to get a connection from the end of the existing end of Argyle Ave to Fertilizer Road through the Part B?
Through the mayor, Hassan, yes. That's the reason why we would not, the county would not give up ownership of Part A at this time. We would only transfer Part A back to Mr. Vandervelde when we are assured that there is approval for phase 4 and that the build out of the streets has happened. That way we don't lose our connection to Fertilizer Road.
Great. Councillor Van Passen, satisfied?
Well, I'm trying to figure out a way to get them to build the road right away, whether there's houses beside it or not, but create that access. I think Councillor Columbus has probably been waiting for that extension for 20 years down there. And let's make up our mind and push it through and get it done. And how do we tie that in with the development that's going on there now?
Through the mayor, I think that would be up to the developer, and perhaps that's a question best suited for the next report in regards to the subdivision.
Brandon, did you want to jump in with something?
Yeah, just a little supplementing for that. When we get to the next report on the subdivision, I would note that we may want to revisit or visit what's labeled as Block 51 on that plan. That is the little nub that Councillor Van Passen refers to between Argyle Avenue proposed bulb and what the right-of-way that we currently have. We may want to establish something there that it couldn't be developed until such time as those road allowances are swapped. So thanks for flagging that.
Anything further from council at this time? Now, the speakers that I have registered, are you wishing to speak to the road or are you wishing to speak to the planning application? Anybody that's online, I'm gathering it's for the planning application.
Thank you, Miss Mayor and members of the committee. Bob Phillips from J.H. Cahoon Engineering Limited. We put this sort of proposal for the relocation of Argyle Street in front of the county because it's a vital part of the proposed development. Since we've actually seen the report in the last little bit and realized there, and we did realize right from the get-go that there was a complication with the Argyle Street right-of-way. One of the items that I sort of proposed in the last few days and had some very quick conversations with staff had to do with the establishment of the Argyle Street right current developed with all the way through to Fertilizer Road, sorry for that, as maybe part of our phase 3 development. And, you know, obviously this is kind of come up with sort of the last minute, but I understand there was going to be no decision made today, but that perhaps can be a discussion we can have prior to the council meeting. We recognize that the county requires that link between the existing developed portion of Argyle Avenue and Fertilizer Road.
Are there any questions from committee members for the agent? Okay, seeing none, I see there's a number of speakers that have been registered. Again, I'm assuming it's for the next staff report, but Mr. Parrott, Helmer, or Ms. Sevilak, are either of you three wishing to speak specifically to the conveyance of the road? Councilor Columbus, go ahead.
Yes, Madam Mayor, I believe they were here to speak with respect to the first application that was dealt with, because they are abutting to all those properties in particular.
Okay, I have them from Kevin registered for this report.
No, sorry, I was making some notes here. through the mayor, yes, all of those individuals are in relation to report CS 2119, the one that we just completed. They are our adjacent property owners.
Okay, so I wish I had known that. All right, so in the context, let's finish with this report. We'll go back to the speakers. We're going to have to go back to the first report then. So finishing off with this report, does somebody wish to move the staff recommendation or propose an alternative? Councillor Columbus? Moving the staff recommendation, seconded by Councillor Martin. All those in favor? And that is carried. Okay, my apologies. We're going to go back to staff report CS 21-19. I recognize it has been moved by council. However, you do need to speak to it if you wish to preserve your rights to appeal. And I had you registered as speaking to the next report. So, Mr. Parrott, did you wish to address the committee?
No, not at this time. Thank you.
Okay, Mr. Helmer?
Hi, I'm just wondering, the Duchess Drive, that road will have traffic coming down it now into the new subdivision, I'm guessing?
Lydia, did you want to respond?
Through the mayor, yes, it will have. I think the proposal for the new subdivision does include opening up the unopened southerly portion of Duchess Drive. And so there will be access to that subdivision area, both off Duchess Drive and off McIntosh as well, with another access to the proposed extension of Argyle Avenue as well.
Okay, and so there's a portion on Duchess, the south portion is still gravel. I'm guessing that will be remedied. It will have to be paved.
Through the mayor, I would have to leave that question, I think, for the planning report.
Yeah, Ms. Helmer, this generally it's not a kind of a question. Usually it's people coming forward to make deputations and so on. You're certainly welcome to reach out to staff with some of your questions following the meeting.
Okay, sorry.
No problem. And Christina, I believe you are the third registered speaker. Are you on the line? Another call for Christina. I believe the last name is...
Yeah, nothing to say.
Okay, thank you very much.
Thank you.
All right, so moving on to staff report CD 2118. That's an application that's been received to approve a draft plan of subdivision application comprising 41 single detached and 9 semi-detached lots. A zoning bylaw amendment application is also associated with this application to change the zoning from development D zone to residential type 1 R1A and residential type 2 R2 zone. 1064928 Ontario Limited on behalf of David and Jennifer Vandeveld and agent Joe Jellis and Cahoon Engineering have put forth the applications affecting the lands described as part lot 22, concession 12, urban area of Delhi. And Mohammed, I believe that you're going to be presenting this report. Is that correct?
Yes, Madam Chair, good afternoon, Council. I'm not sure if Jacob will share the slide. If not, then I can share from here.
Mohammed, why don't you share?
There we go.
All right. So as you can see, to Madam Chair, as you can see the image at the top, The subject land is located in the east end of urban boundary of Delhi. Just to give you a context of the area, Delhi has a population of slightly above 4,200 and will be projected around more than 5,200 by 250. The current housing supply is limited and housing demand is all-time high. And we have seen that the young generations are moving in because of relatively affordable housing price. As you can see in the image, within the urban boundary, there are various left for future development. To deal with this housing demand, good planning and development needs should be prioritized in Delhi. As Lydia mentioned already, the proposed development is phase 3 of the previous subdivision called Bluegrass phase 1 and phase 2. The surrounding areas are predominantly new low-density residential developments, and there are some agricultural lands at the east side and industrial side at the south side. Currently, the land is designated as urban residential in the official plan and zoned as development in the county zoning bylaw.
Can we move the slide deck forward? No problem. Thank you.
All right, and the zoning bylaw is development. And generally, the development zones are identified during the comprehensive review process as potential lands for future development. And this is how these lands are zoned as development. So, Madam Chair, to the Council, the development proposal for phase 3 is for 50 residential lots comprising of 41 single detached units and 19 semi-detached units. A zoning bylaw amendment is associated with this application to change the zoning from development zone to residential type 1 for single detached units and residential type 2 for semi-detached dwelling units. The image at the top illustrates the existing subdivision on the subject land with 4 internal streets that are to be closed as discussed by Lydia already. A portion of the Argyle Avenue currently owned by the county, which is also included within the subdivision application, and this is to be conveyed back to the applicant also. The image at the bottom illustrates the new proposal of 50 lots and a redesigned internal road network. The density change will be from 4 unit per hectare to 13.5 unit per hectare, which will be definitely contributing to the current housing demand. Through Madam Chair to the Council, we have received various technical reports as part of the submission. The reports are reviewed by various staff and agencies. Key comments include recommendation to put a holding until the development agreement is registered, the road closure and conveyance of internal roads, including Argyle Avenue as discussed by Lydia already, and there are some other reports including water and sanitary modeling will be required. So, Madam Chair, no major concerns are received from the member of the committee for this application. There were some inquiries about affordable housing and density, and it is clarified that this proposal is not considered as affordable housing. The next step would be completion of the road closure and conveyance and preparation of conditions for the draft plan of subdivision. That's everything from me. I think Mr. Joe Jealous and agent from Kohuni Engineering will be presenting the proposal. I'm not sure if they're presenting, but I'd be happy to answer any questions. Thank you.
Perfect. Are there questions from the committee for Mohammed? Right, seeing none. Mr. Jealous, did you wish to, or Mr. Phillips, make a presentation? Just as a reminder, you'll have 5 minutes.
Yes, this is Joe Jealous. Madam Mayor, I did have comments. I registered to speak on behalf of the road closures in the previous application. I don't know if you wish for me to do that before I proceed with these comments.
Sure. I did try, I thought I tried to clarify there if there were any other speakers for the previous, we've just moved the staff recommendation, but why don't you speak to that one and then we'll come back to this.
I had my hand up and I sent 3 different notices in for that, and I'm sorry, I tried my best.
Oh, okay, go ahead.
So if I might just comment, Madam Mayor, on the previous road closure application by Lydia first. Then I just have a couple of quick comments with regard to the application that Mohammed just present, and then Bob will have some more comments afterwards as well. And they're very quick. So, Madam Mayor and members of the council, just in case you don't know, I'm Joe Jealous. We're a developer family, and we're doing the Bluegrass Estates subdivision. So if it pleases the committee, I'd like to address the costs associated with the purchase of the lands that Mohammed just showed and as presented by Lydia Harrison in the previous application. The interior lands, as you know, were intended for estate lots back in 1953. And over the course of the Bluegrass development, we've worked along with Norfolk County to bring these municipal services to the full extent of the property, which will, of course, include the phase we're considering this afternoon. The majority of the lands that we wish to include within the next phase of development that will be considered will not be added to residential lands, unlike the previous application at the beginning of the public session. The majority of the lands we wish to include in the development will be returned to Norfolk County with significant improvements. And we're going to be talking a little bit later more about that as we go. So we're seeking council's fair consideration in the exchanging of these lands that are kind of going back and forth in order to facilitate the development. In the interest of making an already complex exchange of land simpler, we're proposing that in lieu of purchasing these lands from Norfolk County at a significant cost, and then designing the infrastructure, the roads, the services, everything that we need in order to, build these homes, and then deeding these same roads with everything back to Norfolk County at no cost would seem kind of excessive and maybe even unnecessary at this point. We would like to include these lands, of course, within the subdivision. And Bob Phillips has a very unique way of even including the link all the way to Fertilizer Road within this application that may be of interest and advantageous to the municipality. Therefore, we would like to respectfully request of council to consider a straight exchange of lands that are kind of going back and forth. We would like to request Tony pay for the surplus land area between the lands that we receive from Norfolk in order to put the subdivision together and what lands we're returning back to Norfolk at the end of the subdivision process or the registration of the plan of subdivision. So thank you for listening to me on that. And Madam Chairman, I can speak on the other matter if you would like.
Does Mr. Phillips wish to make comments in regards to this matter as well?
No, I'll leave that to Joe, and I'll have a quick comment about the plan of subdivision after.
Okay, so we've dispensed with the previous report. Now we're on to the planning report.
May I proceed, ma'am? So then I'm just wanted to comment on the concerns that several neighbors have about our development having low-income housing. I saw in some of the letters special needs housing and subsidized housing. I don't know where this kind of got started, but this third phase that we're presenting to you this afternoon does not involve, does not include, or was never in our intention for those kind of things that we're mentioning. This third phase of development will provide the same quality homes with the same builders as in the first and the second phase of the Bluegrass development. Although the lot frontages are fractionally smaller than the first 2 phases, and that's to conform to provincial policy densities, the new lots can accommodate actually the same size homes with the same quality construction as the existing homes that maybe the neighbors are worried about. And then the semi-detached that's in this development, Well, we have large semi-detached lots. They're 30-foot frontages, and they are freehold homes on, again, very deep lots. We saw the need, and the builders saw the need, so they asked us for something a little more compact for those looking to downsize and eventually to retire. But again, those semi-detached are the same quality with the same builders that built the homes that maybe the neighbors are worried about. So again, we're not designing or building low-income housing, special needs housing, and or subsidized housing. I wanted to put all the neighbors' concerns to rest. And then I'll introduce Bob Phillips, who's going to be really talking about the draft plan conditions. And that's Bob Phillips, our project engineer. Thank you.
Thank you. Thanks, Joe. Very quick comment. Obviously we recognize that we've got to work through some draft conditions through the planning department to come back before council. And we look forward to doing that. We're pretty excited about this development. In light of some of the questions about the lands to the south of the Argyle Avenue right-of-way, we recognize those are designated as employment lands. We through future planning applications, we may ask for some residential, but we certainly recognize the need for the employment lands to be developed. We're hoping we can work through the quote Argyle Avenue relocation item and try to move it up to give the county the assurances that that link will be provided, because we understand right from the get-go through county staff that that was an important element in this area. That's the extent of my comments right now. I understand this is to be received for information, and we'll be back at another meeting. If there's any questions, I'd be happy to answer them.
Questions from committee members? Councillor Columbus.
Thank you. And how soon do you anticipate moving forward with builders on this particular property? As you know, Delhi does not have any lots available whatsoever. We do have a great deal of water and sewer capacity, but no building lots. So people are waiting. They're waiting.
We'd like to get there sooner than later.
As the developer, I am about a year behind because of COVID and everything that's been happening. So we're most eager to get into the ground. Our builders are very anxious and are pushing me all the time to go. I would like to move as soon as I can. In fact, starting the earthwork and the servicing in the wintertime and the fall time, and then have these ready for this time next year. But of course, we have to put all these pieces together in order to do it. I know Bob mentioned the Argyle Street link. He has a very unique plan, and that's to include that entire red section and green section in the third phase of plan of subdivision, all the way out to Fertilizer Ave within the plan. And that may solve the councillor's concern that all of a sudden we have that link and that is registered within the plan of subdivision. It's dedicated back to the Norfolk County, and it's ready to go for that connecting link for it all to be put together. But again, the engineers and staff have to work together to make sure that it's a viable thing.
Thank you, Mr. Jealous.
I just, if I could ask a quick question, Councillor, when I saw your hand, I just want to follow along on that train. So are you saying then that you're going to, your intention is to come back to council to change those employment lands to residential, and that's the trade-off that you're providing the link?
No, I'm not. No, I'm not. No, I am not trading off anything. The employment lands are whatever the Norfolk designates them to be. I may propose something else, but it's just a proposal to maybe make a little more mixed land use of the official plan, and council would have to approve everything within the fourth phase. But the road is the road. And once the road is in, it makes all other things possible with the frontage and the land use. If there's no road that goes all the way through that fourth phase to Fertilizer Road, then it's just a block of land. But again, all this can be worked out as conditions unfold after the third phase.
Okay, it's just, one of the concerns certainly this council is facing is we have very limited industrial lands in Norfolk County. And I'm not sure that, in the past we've converted some that I question whether or not those should have been converted at the time, previous councils. But anyway, we'll look forward to seeing your future proposal. Councillor Huffman.
Thank you, Mayor Chop. Through you to Mr. Jealous. I just wanted to make a point that I'm a little distressed that there seemed to be so much emphasis in terms of the not in my backyard comments from apparently people in the community. I'm a big proponent of not just building subdivisions, I'm a proponent of building communities. And I would assume that any developer or builder who is making or building subsidized housing, housing for individuals with special needs or low-income housing, that they would consider that those would be quality built homes as well. Thank you.
Any further questions from council? Okay, are there, I don't believe, but again, I don't have any registered speakers for this item. Is there any out there? Please just speak up. Don't worry about raising your hand if you wish to speak to this report. Again, is there anyone that wishes to speak to this report? In that case, does somebody from council wish to move the staff recommendation or propose an alternative? Councillor Columbus, seconded by Councillor Taylor. Is there any further discussion on that? Okay, all those in favor? And that's carried. Moving on is staff report CD 2119. That's an application that's been received to amend the official plan with a site-specific policy to allow 10 block townhouse units fronting public streets and rezone the subject site with special provision to permit 10 block townhouse units that do not occupy more than 95% of the usable floor area at first floor fronting public streets. Mr. Rowe, I believe you're going to be, you put forth the applications affecting the lands described as 171 King Street. Mohammed, did you wish to present the report?
Yes, Madam Mayor. I'm going to share the slide again. I hope you can see the slide now.
Yep, we're good.
Thank you, Madam Chair. Through Madam Chair to the Council, is located at the western end of Delhi downtown area and at the north end of Delhi urban boundary. The surrounding areas are predominantly residential and commercial. The site is currently designated as downtown in the official plan and zoned as Central Business District or CBD with a holding provision. To Madam Chair, the development proposal is for 2 townhouse blocks with a total of 10 units. The application includes an official plan amendment and a zoning bylaw amendment. The official plan amendment requested for a site-specific policy to allow 10 residential units on ground floor with accompanying a commercial laundromat. Section 7.8.1 of the official plan related to permitted use does not allow residential use at the ground floor and particularly along the street frontage, and that's why this amendment application is. The zoning bylaw amendment requested for a special provision to allow 90% of usable floor area of ground floor be used for residential use with fronting a public street. The current zoning bylaw section 6.14 does not allow for more than 50% of usable floor area of ground floor be used for residential purpose, and it does not allow residential use at the street frontage. And that is why this zoning bylaw amendment application is formed. The perspective shown on the screen is an illustration of the townhouse block, which is nicely reflected the industrial character of historical development of the area and the site. Through Madam Chair, there are several technical reports are submitted and reviewed by the staff and agencies. A holding is recommended until the site plan agreement is completed. We're waiting for a few other reports which will be reviewed during the site plan stage, including the sanitary and water modeling. The site and industrial site, and the owner notified that the remediation process has been completed. We'll require a site condition record as a condition for the site plan approval. No public comment is received so far, and I think Agent David Rowe is attending the meeting. That's everything from me, and I'll be happy to answer any questions.
Thanks, Mohammed. Question from councillors? Mr. Rowe, did you wish to make a presentation?
Just very briefly, what this new proposal versus the original one that had been approved will bring on 10 rental 2-bedroom townhouse type units into Delhi, where there's a severe shortage of rental accommodation. Also will provide a new laundromat when we've had, I think, the previous 2 or 3 have closed, and there in fact is no laundromat in Delhi at this time at all. So I think from that perspective, it's something that is needed. The architectural designs, I think, have to give credit to our architects. It certainly is a long way from 10 little boxes. The varying roof lines, especially as you're coming into town, will be attractive. We're also proposing, as part of the site plan, a signage, basically community signage, promoting local events and that type of thing taking place in the community. The owner of the development will be the long-term owner of the units, and he has a long-term commitment to this development, as well as a rehab that he did on the former Simcoe and Erie office residential property in town, where he basically totally redid the buildings, brought them up to current standards, and has quite a list of prospective would-be renters, because again, the quality of those units, as well as the quality of these units, will something that is badly needed in the community, especially with the fact that you have a lot of retirees or would-be retirees looking to get away from grass cutting and that type of thing. So this is something that I think is going to be needed, and certainly well appreciated. And again, making it clear that these will be rental units, not for sale type units, and something that there's just an overwhelming demand for rental accommodation, especially with current house prices, which are through the roof. One never expected, certainly in my lifetime, actually bidding on properties in Delhi. That's never happened, and it now happens every day. So again, I'm very excited. I think a good addition to the community, having been here for 70 some years. So I think this is something that we really do need, and will certainly add to the community. That's kind of my bit anyway.
Thank you, Mr. Rowe. That is great. I know it's pretty rare that you find people wanting to get into the rental market these days. Are there questions from councillors? No questions. Does anyone else wish to speak to the report? Again, I don't have any registered speakers. All right, in that case, does somebody wish to move the staff recommendation? Councillor Columbus, thank you. Seconded by Councillor Martin. All those in favor? And that's carried. Next report, our final report, staff report CD 2120, an application that's been received to amend the zoning bylaw of Norfolk County to permit the construction of an 8-story mixed-use building containing ground floor retail units, a retirement home and/or long-term care facility, as well as residential dwelling units. TJ Secuera, on behalf of 2273925 Ontario Inc., has put forth the application affecting the lands described as 185 Robinson Street. And Fabian, I guess you're going to be presenting that report.
Thank you. Through you, Madam Chair. So this application was submitted by the agent, TJ. I don't know how to say his last name.
I clearly watched it as well. So.
It's okay. I'm just going to say TJ from Design Plan Services on behalf of a numbered company. So this application is to amend the Norfolk County zoning bylaw, and there's a few elements that they are applying to amend. So I'm going to break it down into two components. So the first is they're applying to add a long-term care facility and commercial retail units as permitted uses in the R6 zone. The second is to reduce the rear yard setback from 9 meters to 3 meters and to increase the maximum floor area ratio for an 8-story building from the permitted floor area ratio of 1 to permit a floor area ratio of 2.6. And the second component of this application is to amend the zoning bylaw for the following: the step back provision, the angular plane provision, as well as the parking provisions in section 4 of the zoning bylaw. So the reason that I've divided them up into these two components is because the first three components are values that the applicant has provided us with, and the remaining three components, the step back provisions, the angular plane, and the parking provisions, will require more information from the applicant. I do see a few hands up. I'm not sure if
no, I think it's just like Jeopardy here. They're getting in line. So we'll carry on with the presentation first.
Okay, that's fine. Sorry. So, yeah, as you said, the overall proposal is to permit an 8-story mixed-use apartment building, which would contain ground floor retail units, a retirement and/or long-term care, and the development would front onto Queen Street in Simcoe. So the subject lands are located at 185 Robinson Street and is within the Simcoe urban residential area. Historically, the site was home to the cannery manufacturing facility, American, until the early 1990s. So the subject lands today currently includes a 3-story office building, which is where the Norfolk County offices and conventional defense offices are located. So the property is divided up into two parts. It consists of the office component, the parking lot, as well as the vacant portion of the property. So this proposed building would be going where the vacant lot is currently. So the surrounding land uses around the property are predominantly residential and industrial. So the residential properties that surround the area mainly consists of properties that are zoned R2. So as the subject lands are currently zoned R6 and R6H, in the zoning bylaw, the R6 zone permits an apartment building, a home occupation, and a retirement home. It permits a maximum building height of 8 stories, a maximum floor area ratio of an 8-story apartment building, in which a floor area ratio is defined as the usable floor area to the lot determined by the calculation of floor area ratio equals usable floor area divided by the lot area. As well as the step back that is required to be provided is 4 meters, or sorry, for the first 4 floors is 2 meters, and then for all floors above 6 meters, requires a 2-meter step back. So that means floor 6, 7, and 8 would each require a 2-meter step back, which would result in almost a staircase looking like step back, and an angular plane of 45 degrees where the property abuts an R2 zone. So as part of this application, the applicant has also requested that the holding provision on the property be removed, and staff have noted the provision will remain until an agreement and a site is finalized. And currently the subject lands contains all of one parcel, which is 185 Robinson Street. At a later date, the applicant would be applying to divide the property through a consent application into 2 parts. So I know on the maps that have been attached as part of the report, it kind of divides it up between retained lands and subject lands. That was more so just to provide a visual of the application, just to give the differentiation between how the property would be used. So through circulation, there are 2 outstanding comments that were received from the Realty Services Department and from Development Engineering. Realty Services provided comments indicating that Norfolk County, under the terms of its lease agreement, is entitled to the majority of the perimeter parking spaces shown on the map attached to the application. They are entitled to the parking spaces and are to be included within the subject lands parcel of the application. We object to these parking spaces being included in this application, and note to include them puts the owner in violation of the terms of the county's lease agreement. The development engineering comments are as follows. So the current studies, as part of our interurban water supply, we have identified potential supply deficiency in Simcoe. Staff will be undertaking additional studies to confirm this over the next few months, and a further recommendation would be made available. As a result, development applications which have been submitted and will be processed to the point of a public hearing, but under our official plan cannot proceed to a decision and must be deferred until allocation and water servicing is confirmed to be available. In addition to the servicing comments, Development Engineering has also requested updates to their traffic impact study. In terms of letters of concern or opposition from the public, the county has received 13 letters of concern from the members of the public. To summarize the contents of those letters, the major concerns that are outlined in the letters are the height of the building, the parking allocation and the overflow of parking, shadow impacts onto abutting properties, accessibility throughout the site, as well as the increased traffic within the area. So key items for further discussion from a staff perspective include further evaluation of the reduction of step backs at the site plan stage, landscape design and building design, parking and angular plane, as well as another item that I wanted to mention for major staff concerns. So as part of the application, the applicant was required to submit a record of site condition. So the applicant did provide the county with an environmental impact study, which was conducted through a phase 1 and phase 2 study. This was the same report and record of site condition that was provided to the county when the 185 county administration building was created. So because the new proposed use of the property is considered to be a more sensitive land use, the staff has requested that the applicant obtain a new record of site condition through the ministry, and that only once that is received could a decision be brought forward. Staff will answer any comments that are received in the following recommendation report for council consideration. I'm happy to answer any questions that you may have, and the agent is also available in answering any questions, and that the agent is David Eagleman. I'm not sure if TJ is available on the chat, but David is available as well. Thank you. Sorry, through you, Madam Mayor, you're muted.
Councillor Van Passen, go ahead.
Yes, thank you, Madam Mayor. I have a bit of a technical question. Aren't we, as the county, in litigation with the owners of this property? And aren't we, as the county, tenants of the owners of this property? And would that not sort of put the county in a position of conflict of interest if we're even looking at this application? And maybe I have to get our CAO involved here to answer the question, should we be getting some legal advice before we even entertain discussions on this matter?
Through the chair to the councillor, I believe that we will get some legal, and if council directs us, it's a little easier for me to undertake that, to get some legal advice on those two conflict of interest issues. That being said, because this is just a public hearing stage, I think, you know, the items can progress forward, so nothing is unnecessarily delayed while you're waiting to get that legal interpretation. We've had some preliminaries or throughout legal counsel on the matter, but we haven't officially engaged them for a formal response yet. But if directed by council, we can certainly do that.
So would you suggest that, you know, we listen to the input from the public, but you know, we limit the questions or whatever to the public's thing and not have councillors ask questions of the planners and the applicant?
I think that would be best at this stage, though, you know, I don't have the clean legal opinion on that, but I would say we don't want to unintentionally disrupt the normal process of the application. And, you know, council can reserve questions for a later time when they get a stronger legal sense of their standing on the matter.
And Jason, how much time do we have so that we're not put in a position of a non-response? I see Shelley's hand just went up there.
Through the mayor, we do have a proposed legal update scheduled for next week at council and committee.
And maybe the time question can be answered by Mr. Sloan. 15 days.
Yeah, so when would councillors, like I see Councillor Taylor's hand is up, that's obviously his ward, so when would councillors be given the opportunity to make statements?
Yeah, through the chair, there is a prescribed timeline for considering the application. We do have some challenges with considering the applications in Simcoe right now. We do have other matters that we need to consider before moving ahead to a decision, including the water supply update. So we do expect that we at least have a month or two in between. There would be another council meeting on this. It would be advantageous before that final council meeting, though, to have any input through the public forum as to whether or not there are topics that the applicant and planning staff should consider when bringing the application back in the coming months. So even if the topic areas were raised, that might be advantageous, just so we knew what the items are to look at. If there's some challenge with getting into too much detail today until we have the legal advice.
Any further comments, Jason? Otherwise, I'm going to go to.
No, I think Mr. Sloan gave good advice there. I think you can raise your concern based upon topics without getting into details, and then reserve further comments on that until you get legal standing.
Councillor Taylor, did you want to go ahead?
Thank you, Madam Mayor, and through you, I can just go ahead and say I'm a big fan of dense infill. I think we all are on council, seeing that it's the most efficient use of the space. But that said, I don't think we can be doing density at all costs. My concern comes from the transition from that single-story, two-story across the street to an 8-story on the other side of the street. So. Seems to me, I'm wondering if Fabian, if you'd make a comment perhaps on is this responsible, consistent urban design, having that sort of a mixed use there with is it compatible with the surrounding structures?
And maybe Fabian, through the mayor, that's something that we would be able to consider and take back. Like those are definitely important points of that balance between the density and the benefit of having intensification and mixed use and more people being able to walk to shops versus the compatibility and the built form and design to fitting in with the surrounding property. So that's a key item that would be looked at for any planning application. Maybe consistent with what was just discussed. If we don't want to get into too many details, the takeaway I think we have from Councillor Taylor there is that built form and the compatibility with the surrounding area, and looking at the design of this site in relation to across the street, the streetscape. And that I think Councillor Taylor's raising the transition from the downtown and from this site to the next property. So I think those are general enough, but enough direction that those are items the applicant and staff could look at, planning staff could look at.
Yeah, and I certainly don't think there's a need to answer it if we'll get into too many details at this point before that legal advice, but yeah, those are the concerns there.
Okay, Mr. Engelman, is it? Did you wish to make a presentation?
Sorry to interrupt, Madam Mayor. It's TJ Secura. I am the representative of the applicant, and I can make a few brief comments that I think might help clarify a few things that have been said and help couch the comments that may be coming from members of the public. At your discretion, Madam Chair.
No, please go ahead, sir.
Okay, thank you. So, Madam Mayor, you actually hit my last name pretty good right at the beginning there. It's not as hard as it looks. It's TJ Secura. I am a planner and principal of Design Plan Services. I'm here to present information about this application, and we are here to listen. I'm going to, in front of the public and in front of council, as I always do, consistently do, make the commitment to take this back to the owner and continue to work with staff to address any comments. There may be things that we can easily change that may address comments of the public. There may be things that we cannot change to address comments of the public, but we are more than happy to work with the county, council, and staff to do our best to address any concerns or comments that have been made. So this is a proposal for an 8-story mixed-use building. This is at the northeast corner of Robinson and Queen. I'm going to go through my comments very quickly because Mr. Serra did a very good presentation at the beginning. So the current site is 1.7 hectares, and obviously part of the site would be used for the proposed mixed-use building, and that would be eventually severed off, or an exemption from part lot control would be obtained to create a separate and transferable parcel of land. The proposal is generally to site the building to the southwest corner of the severed or the new parcel, which would essentially be at the north end of the parking lot of the existing 3-story mixed-use building. All of the access would be from Cars Street, which is off of Queen Street. And there would be a small access through the parking lot at the east side of the existing building from the south part of the property, which is the 3-story mixed-use building. As was mentioned by staff, the site is currently zoned R6 with an exception zone and a holding zone. It does permit, the proposed amendment would be to permit the long-term care facility, retail units within the mixed-use building. The residential and the retirement home components are already currently permitted with that height of 8 stories. We did apply, or the planning justification report did address the removal of the H. However, I fully acknowledge that there are conditions attached to the H with regards to site plan agreements, and obviously we are supporting the removal of the H once those conditions are fulfilled. We're not asking for it to be removed in advance of that. There was an arrangement between the tenant, which is the County of Norfolk, of the current building, and the new building. There is no intention to remove parking that has been agreed to and is shared. There's no intention to remove any parking that is used by the county. There is an agreement in place. We did look at that agreement. It specifies a number of parking spaces. We're not aware that it specifies which parking spaces. So there might be a movement of some parking spaces in the existing parking lot. However, the intention is to honor that agreement. This proposal intends to provide rental and retirement and long-term care facilities within the county. It would be a proposal that would allow residents to age in place to have a wider variety of living options within Simcoe. And through the site plan process, we would deal with the very detailed urban design matters of the building itself. So that concludes my comments. And again, I just want to make the commitment that we're very happy to work with staff, county council, listen to the concerns of the residents, and come back to staff and council with hopefully something that could be supported by all. Thank you very much.
Thank you, sir. I won't try that a second time. Any questions for TJ? All right, seeing none, Councillor Van Passen, were you wishing to make an addition to the motion? The staff recommendation?
I don't think a motion, but I think direction to staff after you're done with that.
All right, so does somebody wish to move the staff recommendation or propose an alternative? Councillor Taylor, seconder. Councillor Martin, any further discussion on that? All those in favor? That's carried. Opposed? Councillor Columbus, are you abstaining or is the computer frozen? All right, I think we've lost him. Councillor Van Passen, go ahead.
Madam Mayor, I just wonder if we can just give direction to the CAO to get some legal advice on the potential conflict position that we're in as the tenant there.
Staff will take that as direction.
All right, I think that is our final report. Just see here. I guess with that, I just need a mover to adjourn.
Madam Mayor, Mike here. I just had a question, if I could, to Fabian again. It's with respect to the Queen Street, Robinson Street corner, whether there's thoughts about need for a traffic signal light at that intersection. I know many times, even of late, without this building, that there's a lot of traffic jam at certain hours, and I'm just wondering if he can comment on that or look at that when the final planning proposal comes back to council.
Through the chair, that's definitely something that will be in further discussions. The applicant has provided a traffic impact study, which had indicated that no traffic improvements would be required to facilitate the development, but there have been comments from development engineering which required further attention. So I will bring this to development and in order to address that.
Thank you, Fabian.
Councillor Michelle, I've lost visual on yourself. I'm not sure, Councillor Taylor, you're back there. I guess with that, then if I could just have a mover again to adjourn. Councillor Martin, seconded by Councillor Taylor. All those in favor? And that is carried. Thanks very much, Fabian. So with that, we will reconvene with the Board of Health. Let's just take a 10-minute break. So we'll be back at, actually, I guess let's do 4:50, 10-minute break, and we'll be back at 5 o'clock.
Same link, or are we?
Well, I think we'll stay on this link, likely to just move to go into closed, unfortunately, and then we'll have to switch over. The other, yeah, let's do that. We'll come back on this link and then we'll switch over to the other one. All right, it looks like. Kevin, are you back with us? I just muted the council chambers. I think that's why there was an echo.
I am here.
Okay. All right. So I will need a motion to move into closed session. We're back with the Board of Health meeting. This is a discussion item with regards to legal correspondence about an identifiable individual pursuant to sections 239(2)(b), D, E, and F of the Municipal Act 2001, as the subject matter pertains to personal matters about identifiable individuals, including municipal or local board employees, labor relations or employee negotiations, litigation or potential litigation, including matters before administrative tribunals affecting the municipality or local board, and advice that is subject to solicitor-client privilege, including communications necessary for that purpose. If I could have a mover and a seconder, Councillor Michelli, and seconded by Councillor Taylor. All those in favor? And that's carried. All right, so we'll have everybody jump off this link quickly. I guess, Kevin, is that the easiest? And then we'll go on the closed session link?
Yeah, that's the easiest. Just a reminder that we will need to approve minutes. We can do that after close, though.
Well, yeah, that's fine. We'll get this done out of the way, and then we'll run through, and we might even add a couple general discussion items there at the end.
Okay, sounds good. Yeah, the link that I sent around 12:30 this afternoon.
Perfect.
Ivan, the logo that's up there is council, not Board of Health, so.
Thanks. These masks are a nuisance. Yeah, thanks. I didn't notice that. There it goes.
So I suppose the first order of business is to have a motion to return to open session. Mover, Councillor Taylor, second by Councillor Michelle. All in favor? That is carried. And I suppose that I can report that in closed session, we discussed or got updated on legal issues, and also that a memo from our legal will be released shortly regarding the roles and responsibility of the Board of Health. Mr. Burgess, does that summarize the discussion properly?
That's correct.
Okay, so moving on then to the adoption correction of the Board of Health meeting minutes from March 2nd, March 16th, March 22nd. Are there any errors or omissions, Councillor Michelle? I did not see that coming.
Thank you. Thank you, Mr. Chair. Just one very quick one. The March 2nd minutes indicate the Board of Health members present. It has omitted Board Member Rabbits. He was present at that meeting. I'd just like the clerk to add that for him, please.
Thank you, Board Member Michelle. I have noted and will make the changes as mentioned.
Okay, and any other errors, omissions? And if not, those minutes will be adopted. Okay, so if we just adopt them, we don't have to vote on them, right?
That's correct, yeah. Our Board Member Taylor has his hand raised as well.
Oh, okay.
Thank you, through you. Not regarding the previous minutes, but just regarding the returning to open motion. I don't know if you got it there at 6:16. We didn't say that when we were putting the motion out there, just for the next minutes.
Okay, Councillor Michelle, your hand is still up, or is this? Okay.
My apologies, Mr. Chair.
Okay, so the minutes have been corrected. They'll be adopted and signed by the clerk and the chair. So we can go. Is there any other business? Councillor Michelle.
Thank you, Mr. Chair. Is this what we are referring to as general announcements, or is that yet to come?
Certainly, I'm still a little old school, so general announcements, yes.
Okay, thank you very much. Through you, I do want to amend or perhaps clarify a previous statement that I made about the bunkhouse inspections that occurred over the Easter weekend. I just make it clear that I was in no way being critical of the OPP for that event. They were simply doing their job, and I do not have any disappointment with them. My disappointment was with the origin of the order for them to go and do that work. So I do want to make it clear that I am not being critical of the OPP for following the orders that they were given. Thank you.
Any other general announcements? Seeing none. So then we go to the confirming bylaw, Mr. Clerk.
Oh, sorry, Chair Van Passen. Staff just wanted to do a quick announcement with regards to our reservation system.
I got to apologize. I don't have everybody pinned like the mayor does, and my screen keeps bouncing around when they change, and So, but I now see that Heidi, your hand is up, so.
Thank you, Deputy Chair Van Passen, through you to members of the Board of Health and to members of the public. Our online booking system for vaccine appointments went live, and we had such a volume of people attempting to log in that the system got overloaded, and so it is unfortunately currently not available. Our IT department has been actively working on resolving this issue all day, and our team has also been actively working all day to book people's vaccine appointments by telephone and responding to emails. We have had a high volume of calls and a high volume of emails in addition to the online system, so we are working through those requests as quickly as we can. I just wanted to thank the members of our community for their patience, and to let everyone know that if you have called and if you have emailed, a member of our team will get back to you to book your appointment as soon as we can. And also that we will have a public media announcement made regarding the online booking system. But currently, unfortunately, it is not available, and I extend my apologies for that.
And just as a little helpful, what cohort are we looking for to be booking right now, Heidi? Now, have I lost everybody?
Mr. Chair, I don't see her on my screen anymore.
Okay.
Oh.
Yeah. The whole world just changed again here. So.
My apologies, I accidentally logged off instead of unmuted. So my apologies to the board.
Yeah, I just asked whether it could get an update on what cohort or what group should be booking the appointments right now. What status are we at?
Thank you, Deputy Chair Van Passen. We are currently accepting bookings from people who are 65 years of age and older, as well as those who meet the criteria for high-risk health conditions as identified by the province. And if there are questions about that, we can assist with answering those. But the age cohort is 65 plus. There are some communities that are down to 60 plus, but we want to make sure that we're not missing anyone who has a high risk health condition that would put them at higher risk of serious COVID-19 disease.
Okay, thank you very much. Any other comments, questions? Then we can go to the confirming bylaw, the bylaw 2021-10-BH being the bylaw to confirm the proceedings of the Board of Health, the Holloman Norfolk Health Unit at this Board of Health meeting held on the 7th of April 2021. The mover and seconder for that, Councillor Michele, seconded by Councillor Martin. Board Member Michele, seconded by Board Member Martin. All those in favor? That is carried. And a motion to adjourn. Member Taylor and Member Huffman. Yes, there you go. All in favor? That is carried. Thank you, everyone, for another long day. And we'll probably see you again next week.
Night.
Good night.
Thank you, Mr. Chair. Good night, everyone.